Hello, thank you so much for being here. My name is Erin Pellegrin. I am the Director of Culinary Nutrition for Unite for Her. We are a national nonprofit based outside of the Philadelphia area, and I am so excited to be here for this conference, talking a little bit about nutrition and supporting you through treatment. So today I will be taking us through all of the different types of treatment that a patient with a cancer diagnosis may be faced with. But before I begin, I just want to disclose that I have no conflicts here. So first, to get us started, let's talk about when we think of nutrition through all stages of treatment, what are our overall goals? So certainly we are thinking food first, and truly what we're looking for is a variety of foods in our overall choices. So not only just in the types of foods, but even when we're thinking about the different nutrients. So we want a variety of protein foods, healthy fats, complex carbohydrates, nutrients, water, our beverages. Hydration is so important. And this allows us to feel confident that we are getting the vitamins and minerals that we need to serve us through treatment and beyond. Why is this important? We know that good nutrition helps a patient feel better. It helps a patient keep up their strength and energy as they are recovering, as they're moving through treatment. It helps a patient maintain their weight, which is so important, and the body's nutrient stores, also so important. Really key here, it helps with better tolerance of overall treatment and also lowering risk of infection, and ultimately helps a patient heal and recover faster, which is so important. So we know that not every treatment journey is the same, and each individual is different. And so we have to take all of that into consideration as a registered dietitian. We are working with any patient to determine health needs and to help guide you through so that you feel strong and recovered to move forward. So why is nutrition important? Why is this something that we want to focus on through treatment? So let's first start with during treatment. Why is nutrition important? So I mentioned similar to this, but help maintain weight and lean muscle to prevent malnutrition. So adequate nutrition, adequate calories, adequate nutrients are so important. And if a person is not reaching those needs on a long-term basis, what we start to see is a trend down in weight, loss of lean muscle, which can lead to other side effects, such as wound healing impairment, overall energy. We may start getting into balance issues, strength issues. So there's so many things that could happen if we're not maintaining weight and that lean muscle. So good nutrition is so important. We know that proper nutrition and why we think of food overall, it's important for fewer treatment-related side effects. So a person may have more difficult side effects, less tolerance of treatment if they are not eating well enough, staying hydrated. So we know that that relationship is there. Fewer breaks in treatment, so just overall tolerance. It's super important that a patient be able to continue their treatment regimen as prescribed by their medical team, right? And in collaboration with their medical team. And so nutrition helps a person stay on schedule. Fewer hospitalizations, I mentioned, we want to keep a patient out of the hospital. Entering into a hospital, we know increases risk of infection. So we want to minimize that at all costs. And again, good nutrition, good hydration can help achieve that. Overall quality of life. We want to make sure a patient feels as best as they possibly can maintain control of their activities of daily living, their normal work schedule, home schedule as best as possible. And maintaining good nutrition can assist in that. Overall, less fatigue, which is something that we hear so often with the patients that we serve at Unite for Her, but just overall. So good nutrition, good hydration, again, less fatigue, and promotes GI regularity. So if someone is having some issues with constipation or diarrhea, we know that there can be manipulations in nutrition that can ease some of those side effects. So important. In addition, let's talk post-treatment. So we are reducing risk of treatment-related late effects. So that includes changes in body composition after treatment, bone density, something that we're thinking of, especially with certain hormone medications, which I'll get in later in our presentation, cardiovascular complications. Some of our chemo medications and regimens have an impact on the heart. So we want to do everything we can from a nutrition standpoint to make sure we are protecting the heart and always thinking of its health. And as always, post-treatment, we want to try to reduce a patient's risk of recurrence and a second primary diagnosis. And that's where lifestyle and food plays a very important role. Moving on. Let's talk a little bit about numbers here. So first, we're going to start with macronutrient needs, and I'll just kind of go over this high level. But for those that are interested in looking at numbers and what we actually need, protein as a macronutrient is very, very important through all stages of cancer treatment and beyond. So if you are looking for how many grams of protein do I need a day, which is a question that I get quite a bit, we've got some equations here. So as a registered dietitian, I tend to assess a person's protein needs by grams per day. And the way I get there is looking at a patient's weight in kilograms. Quick math, take your weight in pounds. If you are working in pounds, divide by 2.2, you get your weight in kilograms. For an adult with cancer, we are looking at anywhere 1 gram to 1.5 grams of protein per day, depending on the type of treatment, depending on if we have wound healing, depending on if we are seeing a slow trend in weight. So I use an example here of a 160-pound adult. That equates to almost 73 kilograms in weight. So generally speaking, our range of protein is 72 to 100 grams of protein per day. Now, I usually educate that I'm not so worried if a patient exceeds those protein needs. That's great, right? So we're meeting our protein needs, we're going above and beyond. That's wonderful. As a dietitian, what I start to worry about is if I have a patient that is not meeting those protein needs, right, on a consistent basis. Then we start worried about, is this patient at an increased risk of infection? Are we starting to affect wound healing, treatment tolerance? So I think that that's an important piece to call out. We want to make sure that we are at least meeting those needs. In terms of our other macronutrients, carbohydrate and fat, it's really important that overall we are meeting those overall calorie needs so that we can preserve our protein and those amino acids that we use as building blocks throughout the body. We use them for what they are supposed to be for, right? Wound healing, preserving lean muscle, helping our immune system function, helping with creating different hormones and chemicals in the body. Protein is used for all of those things. So we want to make sure if we are meeting our calorie needs, then we are ensuring we're not using protein in different ways. Just overall high focus. Carbohydrate foods, we want to make sure we are focusing on complex carbohydrates, hearty, high fiber, complex carbohydrates, and minimally processed. In terms of fat, we absolutely need fat in our diet, but always thinking of those anti-inflammatory, heart-healthy fats, which I'll get to a little later in our presentation today. In addition, hydration, I've mentioned this several times already, but absolutely super important. We may not always put the attention to hydration that we need. There are lots of reasons for increased hydration. Some examples include some of our chemotherapies can be toxic to our kidneys. Cisplatin we call out, but we want to make sure that we are well hydrated so our kidneys can flush out our body. Super important. Certain side effects Diarrhea, nausea, vomiting put us at an increased risk for dehydration. So staying hydrated is very important. If we have a fever, if we have overall sweating, again, hydration super important. So want to make sure that we are getting in those ounces. And then one final call out in our older oncology population, we know that not all of those thirst mechanisms are in place. Our older population may not feel thirsty all the time. They don't have those triggers. And so we want to make sure that we are staying on top of getting those ounces in throughout the day. Finally, also in our older population, there may be problems with access to groceries, to water, to clean water, also putting a patient at higher risk. So we want to think around how can we make sure that we are staying hydrated, getting fluids in all different forms. Touching a little bit on our micronutrient needs. So we know vitamins and minerals and our different trace elements are super important to ensure overall body functioning, especially when we're thinking of our immune system. They're important for a lot of different reasons, and when we are deficient in certain micronutrients, it can affect a lot of different processes in the body. It can affect the way our organs work. It can cause muscle weakness. It can affect wound healing, and again, altered immunity. So it's making sure that you are working with your medical team, with a registered dietitian to ensure if you do need supplementation and how much is appropriate. I'd like to call out some things to think about in terms of different health issues and how they may affect some of our micronutrients. So for those that may develop GI fistulas, diarrhea, we know that some of our vitamins, trace minerals, zinc, selenium may be decreased. Pancreatitis affects our absorption of B12. If a person has had a part of their stomach removed, their ileum in a resection of our GI tract, there's a decrease in iron and B12 absorption. So important to recognize that. Overall critical illness, vitamin C tends to be decreased in the inflammatory process. So really important we are supplementing with that. And then finally, again, cisplatin can cause a decrease in magnesium. Not to say that this always happens, but something to be aware of. In addition, also worth calling out that serum lab levels of our micronutrients don't always mean a patient is deficient in some of these nutrients. The inflammatory process can cause an acute decrease in some of these levels. For example, selenium, copper, iron, and zinc can be acutely low in a patient for a variety of reasons as a result of that inflammatory process. So that does not mean a person is deficient, just means that something is going on and we are abnormally low in those numbers. On the other hand, some of our other vitamins, thiamine, riboflavin, B12, and folate, are not affected by the inflammatory process. So if we see low levels in labs, that may be a deficiency. So understanding these nuances is really important, and even more so why we want a patient to be working with their medical team, working with a registered dietitian to determine if supplementation is in fact appropriate. Okay, jumping into the different treatment options. So I will be covering all of these: surgery, radiation, chemotherapy, immunotherapy, hormone therapy, and then some guidance beyond therapy moving forward. So let's start first with surgery. So overall nutrition goal with surgery, supporting wound healing, right? We want to make sure a patient heals adequately and heals well. Things to consider: is a patient on pain medication? Is that affecting constipation, which we know is notorious for our opioid medications? How is that affecting our nutrition? Has there been an alteration to the GI tract? For example, those that may have had a surgery on their pancreas, is it affecting the digestion of some of their nutrients? Does it require pancreatic enzymes? Things to consider. Has part of the GI tract been affected? Has part of the bowel been resected? What part? How does that affect absorption of nutrients? And also, as through the healing process, how is food being brought back in to a person's diet? And working alongside, so it just doesn't happen overnight, right? We know that there is a process to bringing food back in. There are slow steps to be taken so that a patient can adequately tolerate different foods. But all the reason why we want you working with a nutrition team. Foods to call out during surgery: Protein, of course, we think of protein with wound healing. So making sure a patient is getting protein with every meal and snack throughout their day, whether it comes from a plant or an animal. Again, calling out calories, making sure a patient meets all of their nutrient needs and energy needs, so that protein can be reserved for wound healing and preserving lean muscle. And then our calories are used for overall recovery, energy, helping with fatigue. Hydration is really important and not something that everyone thinks of when they think of surgery. I like to use the example of, if you think of your hands or your skin in the middle of winter, right? Dry, cracked. Dehydration can act similarly when we're thinking of promoting good tissue regrowth. We want our cells to be hydrated. We want to make sure that they heal adequately. And also calling out vitamin C. That plays a very important part at the cellular level with wound healing. So doesn't mean we have to be supplementing with vitamin C, but I always like to call out making sure we can eat those vitamin C foods throughout our day, not just our citrus foods. Think colorful bell peppers, strawberries, our dark leafy greens. All of those are wonderful sources of vitamin C. And then finally, movement activity. We want a patient to get up and move around gently as soon as it is safe, so that we get blood flow, we get oxygen delivery to the cells, again, promoting wound healing. Okay, moving on to radiation. Again, sort of similar to surgery and wound healing, we are supporting tissue regrowth. We are supporting those skin alterations. Couple specific considerations to call out, though, for going through radiation. Side effect management, most certainly cancer-related fatigue, the lethargy that comes along with it. I mentioned in the beginning the importance of good nutrition and hydration, and how that can aid in some of that fatigue that a patient tends to experience. So want to be mindful of that, but also understanding that more than likely a patient will experience some. How can we make food preparation and feeding ourselves convenient and not a hassle and not energy draining, right? So we'll talk about prep and convenience foods in just a moment. Very important. Looking at areas of the body that may receive radiation. So head and neck, upper GI tract. We know that when a patient has radiation to the head and neck, they're at an increased risk of irritation of the oral cavity. And upper GI, we know that it can present or can result, I should say, in weight loss in up to 80% of patients. So nutrition is absolutely key in addressing the needs. Chest and abdomen can result in swallowing issues, sore throat, loss of appetite, a cough, shortness of breath, right? So we have to be mindful of how can we meet our nutritional needs, understanding those side effects. Pelvic area, again, the majority of patients, when the lower GI or the bladder is involved in the radiation to the pelvic area, up to 80% of patients can have some GI side effects. So how are we going to address that? How can we make sure a patient is meeting their needs, but working through those side effects? So all strong considerations. In terms of our food choices, again, calling out hydration, the close relationship between staying hydrated and fatigue is really important to call out. So meeting those hydration needs. Water is, of course, our best hydrator, but we're also looking at our hydration from other beverages, from our fruits and vegetables, things like broths, other things that we can incorporate hydration into, like smoothies and juicing, any way that we can get ounces in, super important. Again, calling out protein, right? Wound healing, tissue regrowth. So making sure that we are incorporating protein foods throughout our day with all of our meals and snacks from both a plant or an animal source, really important. Antioxidants. So I do recommend that we lean on getting antioxidants from our food solely, especially through radiation. So any supplements a patient may taking, vitamin C, vitamin E, we hold off and we lean on getting those nutrients naturally from all of our food, especially our fruits and vegetables. And then food, thinking about, yes, is a patient experiencing fatigue? How can we make sure that meal prep is taking place at a time when a patient feels good? How can we leverage those opportunities so that when they are feeling particularly tired, it's been a long work day, it's been a long week of treatment, we can ensure that there are convenience foods, easy foods available to make food preparation easy and attainable, but also nutritious. So keeping in mind meal prep, convenience foods, keeping them on the back burner. I love in the freezer, stocking your pantry with them. So just some tips, but we'll cover this again at the end of our presentation. Next in our treatment list, chemotherapy. This is a big one, right? This is something where I am working with patients most of the time as they are working through chemotherapy. Most important, we want to prevent unintentional weight loss. We know that unintentional weight loss trending down can lead to worse outcomes, malnutrition, making more difficult to rebuild healthy cells, making it more difficult to continue through treatment cycles, delays in treatment. So making sure that we are preventing that and meeting our calorie needs, super important. Also, again, going back to that maintaining lean muscle, when we are taking in adequate calories, healthy calories, we're preserving that lean muscle protein for the job that is particular to that. But also thinking about how are we going to work with a person to manage their side effects? And there is a long list, as you can see in front of you. Appetite changes, GI issues, fatigue, oral cavity issues, making eating not only uncomfortable and painful, but just affecting swallow, taste, the appeal of different foods, nausea, taste and smell changes. So how can we take those into consideration and make sure that we can work around them and use food as a way to maybe support some of those side effects, improve some of them, and still make sure we're getting in our calories and protein. Foods to call out. Again, protein foods from both a plant and an animal, so important. When a patient is going through chemotherapy, I like to say, please be gentle with yourself. We are just trying to help you heal, trying to help you feel your best. Some of those healthy expectations we may have at other times, we want to set aside, right? And let's really lean into how can we manage these side effects? Let's be gracious with ourselves, and let's just try to do the best that we can. Leaning into fruits and vegetables in any way that we can. And the more variety, the better. The more color of our produce, the better. So anytime we can get variety in, it's a good thing. If a person chooses to consume low-fat dairy or a dairy alternative, it can be fortified and a great source of different nutrients, vitamin D, calcium, even some of our B vitamins. So supportive of overall health, especially our bone health. So and some of our dairy options, thinking of low fat, so we're always protecting our heart. Also a good source of protein. So if a patient is deciding to consume those foods, they can be a really great option. Whole grains and starchy vegetables, those complex carbohydrate, which is a source of energy, which is supportive of our microbiome, where so much of our immune system is housed, and the development of our immune cells. So that fiber, those complex nutrients, so important. Heart healthy fat, again, always thinking of our heart and incorporating fats for satiation, for fat soluble vitamin absorption, but making sure that it is those healthy omega fats that are anti-inflammatory and supportive of overall health. And again, calling out hydration, right? We know that it's just overall so important. Getting in enough fluids in any way that we can, assisting with staying hydrated, moving forward. It can be a challenge, but using different techniques, taking small sips throughout your day, setting reminders for yourself, even utilizing a cup with a straw. Some of us tend to reach for that cup a little more when there's a straw versus just drinking out of a bottle. So talking with your medical team, your registered dietitian about different techniques that may work for you. Above all, again, be gentle. We're trying to work with you to adjust your food choices and the preparation of those foods in a way that will feel good to you, that will serve you based on the side effects that you are experiencing. There is almost always a way around it. There is always a way that we can use food and healing properties. Let us help you. Some quick food safety guidelines I like to call out because, especially going through any kind of treatment, food safety is top of mind. We want to make sure we are reducing your risk of foodborne illness. So let's check those expiration dates. Look for damaged cans if we are stocking our pantry, making sure we're appropriately thawing our food, and we're not letting it thaw and sit out all day, but we are cooking it right away. Making sure that we are staying on top of refrigerating leftovers right away. And again, not letting them sit out so that we are in the danger zone of bacterial growth. Keeping hot foods hot and cold foods cold. Again, that ensures reducing risk of bacterial growth, foodborne illness. Making sure we're checking all of our meat, poultry, fish for sell dates, for smells, for all of those cues. And so we're making safe food preparation, avoiding raw items like eggs and fish, especially if a person is neutropenic, where their white blood cells are so low, they have a difficulty mounting an immune response. So avoiding those raw foods for the time being, super critical. Avoiding food buffets, and a place where all of people gather, increased risk of germ exposure, washing our hands, and being mindful of cross-contamination and washing our produce well. Even if it says triple washed, make sure you wash that produce well. Moving on to immune therapy. So this is a really lovely review that talks about the importance of food and nutrition and a healthy microbiome, a healthy gut, and how it can support our immune system. Our overall nutrition goal, let's support the body's immune system and the immune response, right? We can do that with a lot of different foods. Fruits and vegetables, vitamin C and A are super supportive of our antibody and white blood cell production. So reach for the more variety, the more color, better. Green tea, the ECGC that's in it can support immune system and can help with fighting infection. So drink that green tea each day. Garlic, as part of our allium family, supports our body's T cell production, part of our immune system. Nuts and seeds, vitamin E, healthy antioxidants, again, support overall immunity. Lean protein, calling out again, our antibodies are made up of amino acids of protein. So let's make sure we are getting those protein foods so our immune system can create what it needs. And then yogurt or any fermented dairy or non-dairy food. It is a lovely boost of probiotics, supporting healthy bacteria in our gut. So reaching for those fermented foods is a good choice. Specific nutrients, again, those heart-healthy omega-3 fatty acids that we are finding in not only our fatty fish, but our nuts and seeds support white blood cell production. Think chia seeds, flaxseed oil, flax seeds, walnuts. Great sources. Selenium and zinc support our immune system, support white blood cell production. So getting them naturally from our fruits. Selenium, Brazil nuts, I think is the first thing that we all hear. So eat that Brazil nut every day. And then vitamin C plays an important role in T cell production. So again, the variety of foods ensures that we are getting these different micronutrients to support our overall health. And then finally moving into hormone therapy. So I liken hormone therapy and hormone balance and using food as one part of the symphony, right? Hormone balance and addressing it, it's complicated. There are lots of different parts to it. It's not just food. And that's why I list those here. So when we think of nutrition, fiber plays an important role in hormone balance. So getting in those fiber foods from our different plant sources, limiting or avoiding alcohol, avoiding or limiting ultra-processed foods. So we're really reaching for those complex carbohydrates, minimally processed foods, really nutrient dense. Phytoestrogens. We know that phytoestrogens, the plant form of estrogen, is very health promoting, and consuming whole foods that contain phytoestrogens is actually very healthy. So think organic edamame, tofu, Fermented soy like tempeh and miso, super wholesome food sources that reduce risk of cancer diagnosis overall. I do always say that if consuming soy foods or foods that contain phytoestrogens is anxiety provoking for a person, despite what we know in recent research, it is not worth consuming them. We do not want food to be a stressor for you. There are lots of other healthy foods that you can consume. Exercise, maintaining a healthy weight is very important for overall hormone balance, getting adequate sleep, and addressing our emotional and mental health. Super, super important. We know the close relationship between our hormone balance. And then finally, let's think about post-treatment and beyond. I really thought that this slide, the American Institute of Cancer Research just does a wonderful job of calling out what we want to do post-treatment and moving forward. So essentially what their recommendation is, once you are past that acute stage of treatment, we are following those same cancer prevention guidelines moving forward. So let's be as lean as possible within a normal body weight range. Be physically active every day, limiting consumption of energy-dense foods and sugary beverages. Eating mostly plant foods. Let's incorporate them in our fruits and in our snacks and meals. Limiting our intake of red meat, especially our processed meats, as well as alcoholic beverages, monitoring our consumption of salt overall and how much we're using and where we're getting from in some of those fast food and convenience foods. And then just being mindful of getting our nutrients from food first, right? Not leaning on supplements or other fortification, but really leaning to whole food first. And then to wrap up our presentation today, just some things to think about to set yourself up with success, some tips to take with you. If you are going through any form of treatment, stock that refrigerator, freezer, pantry with healthy foods, make things readily available, especially the foods that you know you do well with, right? Let's keep those on hand. Think of convenience foods, things that need little to no preparation so that when fatigue is running high, energy level is low, other side effects are taking place. Let's make food preparation as easy and minimally effort as possible. When you are feeling well, leverage that time. Maybe take a little bit of time to do some meal prep, do some preparation that you can freeze in individual portions so that when you need them, they are there for you. Let others help you. When others reach out and say, what can I do to you? What can I do for you? Allow them to help. Give them recipes, give them a shopping list, give them your grocery list of things that you need and say, I would really appreciate it. This, if there's a particular recipe or a dish, this would feel really good for me. Could you make this? I would appreciate it, but let others help you. And then truly at the end of the day, I think this is a time just to call out, be gentle with yourself. Let expectations go. This is a difficult time. Treatment of all kinds brings challenges. You are doing your best. Lean into your medical team, lean into the dietitians around you. Let us help you through it. Be gentle. So here are just sharing some of my sources if anyone is interested. And then overall, I just want to thank you for being here. Thank you for attending this conference. Thank you for listening. Hopefully there are some takeaways for you to help you through your treatment journey.